Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College. I'm also principal investigator of the Tennessee Community Engage Alliance Against COVID-19, also known as Tennessee SEAL, and site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, September 19th, 2022. As we head into the fall, we know that there is a potential for an increase in infections, in part due to increased waning of immunity from vaccines and prior infection. Additionally, as the weather gets colder and people spend more time indoors, contagious viruses like COVID-19 can spread more easily. In addition, fall is the onset of flu season, and we are expecting a more severe season than usual this year, based on reports from countries in the southern hemisphere that have already had their flu seasons. And as we saw last fall with the emergence of Omicron, we must continue to stay prepared for the possibility of a potential new variant of concern. There are a number of similarities between the flu and COVID viruses, symptoms, and how vaccines are developed. So today I'm going to start by talking about flu and COVID and the need for getting vaccinated for both. I'm going to talk about similarities and differences in symptoms, risk, complications, transmission, and treatment, and the risk and the danger of getting both at the same time. I will then talk about the vaccine recommendations, about when to get the flu and COVID vaccines, and what we know about getting both vaccines at the same time. I will conclude by providing an update of COVID cases, hospitalizations, and deaths, both nationally and in Tennessee. Health officials are warning that this year the flu season is likely to be more severe than normal. That's because we haven't had much of a flu season in recent years and our immunities have waned. Typically, we will start seeing influenza outbreaks in the United States as early as November. Flu season typically peaks December to February, but the virus can circulate through May. Flu can be especially severe or deadly to elderly adults, very young children, pregnant women, and people with compromised immune systems. The U.S. Centers for Disease Control and Prevention recommends that all people aged 6 months and older be vaccinated against the flu. The flu is caused by influenza viruses types A, B, C, or D, while most flu-related illnesses are caused by influenza type A or B. Influenza viruses, like the coronavirus, are constantly changing parts of their genetic code through mutations. Constant mutation means that the dominant strain one year may not remain the dominant strain in following years. This is why the influenza vaccines change each year, to better match the likely strains causing infection. It is also why people are advised to get a flu shot every year, so they can produce the antibodies best matched to defend against the influenza viruses currently in distribution. Next, I'm going to do a comparison of symptoms of flu and COVID-19. According to the Centers for Disease Control and Prevention, the symptoms for both conditions can range from asymptomatic to severe. For this reason, it is hard to know the underlying cause based on the symptoms alone. That's why we have COVID tests. In the case of either illness, at least one day may pass between the time a person contracts the virus and the start of symptoms. A person can also spread either virus before becoming symptomatic. The symptoms of both flu and COVID-19 include cough, fever or chills, fatigue, shortness of breath or trouble breathing, muscle pain or aches, sore throat, runny or stuffy nose, vomiting, headache, diarrhea, and changes in or loss of taste or smell, although this symptom is most common in COVID-19. While different viruses cause COVID-19 and the flu, the two conditions have several similarities, including the following. Persons at risk of severe infection include pregnant people, older individuals, and those with pre-existing conditions have a higher chance of experiencing severe effects from both conditions. Both conditions can cause potentially serious or fatal complications, including pneumonia, worsening chronic conditions, heart attack, stroke, respiratory failure, inflammation in the heart, brain, or muscles, multiple organ failure, acute respiratory distress syndrome, or secondary infections. The influenza virus and the SARS-CoV virus are both airborne. They attach to particles propelled into the air through talking, sneezing, or coughing. A person may spread either virus at least one day before their symptoms appear. Both conditions may require specialized treatments in a hospital setting, particularly for complications or underlying health conditions. Vaccinations are available for both flu and COVID-19. According to the Centers for Disease Control and Prevention, the symptoms for both conditions can range from asymptomatic to severe. Differences in the two, while flu and COVID-19 have many similarities, they also have distinct differences. These include risk of severe illness. According to the CDC, COVID-19 is more likely than the flu to cause severe illness that can result in hospitalization or death, even in younger, generally healthy people. It also presents the possibility of post-COVID-19 infections or multi-system inflammatory syndrome, whereas flu does not. People who have flu have a higher rate of developing secondary bacterial infections than those who have COVID-19. However, people with COVID-19 have a chance of developing multi-system inflammatory syndrome, blood clots, and post-COVID-19 conditions. COVID-19 is more contagious than flu and has links to superspreader events that contribute to rapid increases in the number of people who have contracted the virus. Doctors have several approved antiviral medications to treat the flu at home and at the hospital. COVID-19 has emerging treatments, including approved antiviral medications. The FDA has also authorized the emergency use of not yet approved therapies to help treat COVID-19. Each year, several vaccinations become available for flu, while only 3 approved vaccinations are available for COVID-19. Flurona is a term that some people have used to describe having influenza or the flu and COVID at the same time. Based on a review of data from 2021, it is estimated that 1.2% of people with COVID might also get the flu. Next, let me talk about the vaccines. So flu shots, like COVID vaccines, reduce risk of getting the flu and significantly reduce the risk of getting severely sick if you do catch the flu. The level of protection provided by a flu vaccine, like the coronavirus, can vary according to a person's age and health conditions they have, and how much flu virus is circulating in the community, and how good a match the vaccine is for the virus strains that are the most prominent for that season. That said, vaccinations are a major strategy in reducing the number of people who are infected with both influenza and COVID-19 during the year, and clinical findings suggest if someone does become infected, the severity of an infection will likely be much reduced after immunization. Whether you have had flu previously or have had an influenza vaccine in the past, current evidence suggests that any antibodies you made will become less protective with time. This may be because the level of antibodies in your body decline, or because the antibodies you have do not work against the influenza type currently causing infection. This year, five quad, quad, quadrivalent influenza vaccines have been approved against four of the most common influenza strains currently causing infection. In comparison, the new COVID Omicron vaccine was formulated as a bivalent vaccine that is protective against both the original virus and the Omicron variant. As the United States begins its fall booster campaign, some health officials are urging people to consider getting their COVID-19 booster and the flu shot at the same time. According to the CDC, people can safely receive both vaccines at the same time, although they may be slightly more likely to experience side effects such as fatigue, headache, and muscle ache. In a recent article published in the Journal of American Medical Association, JAMA Network, researchers found the simultaneous administration of mRNA COVID-19 booster, both the Moderna and Pfizer COVID vaccines, along with an influenza vaccine, is associated with a statistically significant increase in systematic reaction in the 7 days following vaccination. When compared to the administration of a COVID-19 mRNA booster alone, recipients reported an 8 to 11% greater chance of reactions. The study found most reactions were reported as mild or moderate and were recorded most often on the day after vaccination. The most frequently cited reactions included fatigue, headache, and myalgia, with less than 1% of those who had co-administered vaccines reporting the need for medical care. Local reactions were more frequently reported among adults ages 65 and older, following the high-dose influenza vaccine than standard dose vaccines. It is unclear whether this will be the last COVID booster offered or whether there will be new boosters on a regular basis. Moving forward, COVID-19 vaccines could become a more routine part of our lives, as the nation may need to administer an updated booster every year, since the coronavirus probably will continue to circulate for the foreseeable future. The United States could offer the vaccine each year around the fall, similar to the flu vaccine, if the virus surges become predictable. Now let me switch and talk about current COVID cases, hospitalizations, and deaths. So fewer than 70,000 coronavirus cases are currently announced each day in the United States, the lowest level since early May. Cases are flat or falling in nearly every state, and in many places the declines are significant. More than a dozen states and territories have seen cases decrease by 40% or more since the start of the month. Hospitalizations have also seen sustained improvement. Fewer than 35,000 people are currently in American hospitals with the coronavirus each day, a decrease of 11% over the past 2 weeks. Data on new coronavirus deaths is volatile at the moment because of the lingering effects of the Labor Day weekend, when many states did not report. Still, deaths today are far lower than they were a year ago, when the Delta variant was causing nearly 2,000 deaths per day. Newly reported cases of COVID-19 in Tennessee are down 45% over the past 14 days to less than 1,800 per day. Hospitalizations likewise are down by 19% to 685 per day, and deaths are down by almost 50% to 0.11 per 100,000 of the population. Test positivity rate is down from 0.21% to 0.18%, still well above the national average of 0.11. However, there are several counties that continue to have very high test positivity rates, including Meharry at 51%, Cocke at 40%, and Hamblin at 37%. The percent of persons in Tennessee who are fully vaccinated remains at 55%, where it has been for 4 months. 9 Tennessee counties are still in the CDC's red zone for community COVID level. All but 2 are in the northeastern region of the state. 29 other counties are now in the yellow zone, including Davidson and Williamson counties. 57 counties, over half of the counties in Tennessee, are now in the green zone. So for now, this is Dr. Paul Juarez from Tennessee SEAL and HealthWorks, wishing you a good day.